I think the magic is in the connections that we build with all the other community organizations here in San Francisco and in the Bay Area. It's just so valuable to be able to refer families to Homeless Prenatal or to Mission Neighborhood Health Center, or here in the Bayview Southeast Health Center, and to connect with the staff at General Hospital and at CPMC Mission Bernal and Kaiser and Mission Bay. You know, we are one piece of the puzzle, and we talk a lot at Sister Web about how the doulas are part of the overall support team, and how we can't separate ourselves from, you know, we talk about the medical team, the doula team, the familial support team, but we're all working together in community to support a family during their journey in pregnancy and childbirth. So it's beautiful to be able to connect, to have relationships with those different community partners where I know who to call up and who's going to take my phone call and who can get this client in to get the resources that they need when they need them. Our connections with the community partners have helped us get our families those resources that they need right now. For example, just a couple of months ago, when a lot of our families were facing the threat of eviction and or were buried under thousands of dollars of debt, of rental debt, we heard from a community partner. Hang on a second. We heard from Lydia over at the Center for Youth Wellness that in collaboration with YCD, they would be able to provide our families with $1,000 each in order to, or they would be able to provide $1,000 each to eligible families in our program to help alleviate some of that debt that they're carrying.
Oh, without having a doula, because doulas, especially Spanish-speaking doulas, you know, we need more of us. And so with this role, the families have been able to get support for preparation for their labor, and, you know, support with the postpartum. And my time there, you know, we've been able to get donations for a pantry. So we do a pantry every Monday, and we also get donations for diapers, and we get wipes. And so, you know, especially with COVID right now, a lot of outreach and community events we've had to become really creative with the way that we connect with families. And so I really enjoy supporting the pantry. It's a way that I get to see like the family's faces, and I get to give them information, and they also get to go home with some food and some diapers. And I think that's a really great part to, as a great resource that the clinic is able to offer birthing families. Something that I see like SF General and the clinic also offer is like rides to the hospital, taxi vouchers, like coupons to get to the hospital. And so I think that's a great resource that we've been able to connect families to. If you want to add that.